We know that many children are actually born with deafness, which is a congenital deafness, and the figures are pretty high. About up to 4 children born per 1,000 can be born with deafness, and some of these deafness can be absolutely irreversible, and therefore they need special attention, because once they are born with hearing loss, they do not develop normal speech. And that is why it is important for us, the society, the medical professionals, everyone, to understand the need for early detection of these children. If we can detect these children early, then we can rehabilitate them to get speech therapy and hearing amplification device. Now, earliest detection of deafness can be done even after birth, which is a very small 1 or 2 minutes test, and then subsequently this can be confirmed at 3 months, and then at 6 months we can start the child with hearing amplification. Most of the time we can give hearing aid and speech therapy, and there are children who would not benefit from a very high quality hearing aid on both sides, and those children actually will benefit from a surgical procedure called cochlear implantation, which is nothing but also a hearing device which is through an operation which can be implanted into the inner ear, which is called the cochlea, which is the sound transmitter generator of our body. So it is important at the same time that we pick up these children early and do their intervention, because there is a specific period of life where we have speech acquisition, and the speech develop in a normal hearing child from 1 year to 3 years. By 3 years, most of the children are able to speak a few sentences quite nicely, and so if we can rehabilitate these children by 1 year or at the most 2 years, 2.5 years, then we are still at the stage where the child will pick up speech, and by giving them hearing amplification device, either by surgery or just by wearing hearing aid and continuous speech therapy, we can give them good speech. They will eventually develop good speech, though a bit late, but they can develop a full normal speech eventually, and they can go to normal school, as opposed to children who are detected very late and they have to go for vocational training and other special school, etc. So this is the essence of today's message that we want to give from our clinic AM Medical Center, that these children should be detected early. So the moment a child is born, you should insist on a test which will give you a clearance that the child is hearing well. If that is doubtful, or if there is a faulty hearing, then it should be retested by 3 months, and by 6 months some treatment must start. With this, we will be able to take all these children that I have mentioned the figure to the mainstream, where they can excel in their scholastic development and normal activities in life.